Liquor stores will open their doors again at 9 a.m. this morning. Now, the ban on alcohol sales has been lifted as the country moves to level 2 of the national lockdown. But the Southern African Alcohol Policy Alliance says it's quite worried about a possible increase in alcohol-related trauma cases. The organization further says it would have preferred it if government had implemented stricter restrictions. So to discuss this, I'm now joined by the Alliance's Maurice Smithers, of course, to take me through what are some of their concerns. Maurice, a very warm good morning to you. It seems that as the rest of South Africa is gearing up to potentially queue up to stock up on alcohol after quite some time, you have your concerns. You believe that there could have been stricter measures. Share some of those concerns with us.
Sure. Thanks very much for giving us the chance to talk about it. First of all, let me just say that it's not the rest of South Africa that's going to be queuing up. And the reason I say that is because actually only about 31% of people aged 15 and above actually drink alcohol in South Africa. So I think one always needs to bear that in mind when one considers why our concerns are so serious. Because the problem with alcohol in South Africa, and this is a problem that predated COVID-19, is that we'd have high levels of alcohol-related harm. High levels of car crashes, violence against women, and so on. And those problems haven't gone away. The ban on alcohol perhaps put them into abeyance for a while. But the fact is that unless we implement new regulations in the country going forward, those problems are going to recur. So the new regulations, level 2 regulations, have got some control, but only really 3 controls really. 4, okay, let's say 4. There's 4 controls that we can see. The one is that bottle stores stay open from 9 to 5, so that, on Mondays to Thursdays. So that limits the amount of alcohol you can buy on a daily basis from bottle stores. Restaurants, bars, taverns, and so on need to close at 10. That's a very good thing to do because one of the challenges around alcohol is a lot of the violence that happens in the late hours of the night and the early hours of the morning. So that's very good. The third thing is nightclubs, and that's an obvious thing, is that because nightclubs are very intense places, so it's a very good thing for them still to be closed. And then the last one is the limiting the number of people that can be in bars and restaurants. But that's all. There's nothing, and there's no other steps that have been taken to see if the levels of alcohol harm can be reduced. So we unfortunately are looking to a spike in alcohol-related harm happening, particularly on the weekend, which is when the trauma admissions to hospitals happen in greater numbers, from gunshot wounds, stab wounds, various other violence, gender-based violence, and so on. And we just think
in more burden on the health sector, because then you find that more cases of alcohol-related incidents are occupying beds in casualty, which are meant to support COVID-19 patients. So what measures then would you then propose as an alliance to ensure sort of an alcohol-safe South Africa, but also just to further support level 2 lockdown in ensuring that there isn't an overconsumption of alcohol, do you think?
Well, there's quite a few measures that we've actually suggested, some of which, by the way, interestingly enough, were tentatively promoted by the liquor industry itself at around the 1st of June when they were wanting the first ban to be lifted. I noticed they're very silent about those things at the moment, which means that they're probably happy that they've got the ban lifted and they can go ahead. But we think, for example, advertising should be banned for now, except at point of sale. We think that the size of containers should be limited. For example, we shouldn't have 1 liter and 750 milliliter bottles of beer, or 5 liter casks of wine, and so on, because that just encourages people to drink more. There shouldn't be any special offers where you're offering people more bottles of beer or bottles of whatever, in order for cheaper prices to get them to buy more. The blood alcohol content level in South Africa for drivers is already in the Road Traffic Amendment Bill, which still needs to be passed. That should be reduced to help to reduce the level of car crashes. IDs, which is something the liquor industry agreed to, IDs should be shown at every time somebody buys alcohol. One, to reduce underage buying, and two, is maybe to reduce the amount of alcohol that individuals buy on a daily basis. And the other thing, again, which is in the Liquor Amendment Bill of 2016, which is also still to be passed, is increasing the age of drinking, because that's also a big problem. So you're reducing the number of people who might be drinking. So there's a number of measures which would be very helpful right now around trying to prevent a resurgence of the COVID, but also would be putting in place steps to make South Africa an alcohol safe country going forward.
Right.
As I mentioned at the beginning, only 31% of people actually drink. So therefore, it means the majority of people in South Africa are having to endure the problems that are caused by the harmful use of alcohol.
We'll have to leave
and
it
something
at that,
must
but
be
thank
done.
you so much, Maurice. Thank you so much. Quite clear and, quite valid. There's something has to be done to ensure that there is control when it comes to overconsumption of alcohol. That's the Southern African Alcohol Policy Alliance's Maurice Smithers, of course, joining us right at this moment.